catch up afterwards. Thank you for joining us today for the Strengthening Families 101, which we do every once in a while. And it's especially relevant right now because we have updated our Strengthening Families materials recently. So we like to use this networking webinar time to make sure everyone has the latest information about strengthening families. And we're doing this in collaboration with the Together for Families conference. So this is technically a pre-conference session for the Together for Families conference, but it is open to anyone. If you would like to learn more about strengthening families and related work, I encourage you to still register for that conference. It's coming up in less than 2 weeks, but if you don't have those 3 days fully open, you could register and still catch a lot of the content, watch the things you're interested in that will all be recorded. They'll be on the website or on the Whova platform the day after they occur, and then you'll have access to them for 3 months. So registering for the webinar gives you access to all that content, even if you can't fully participate on the days of the conference, since we know it's getting close. But I hope many of you have registered for the conference, and that's why you're here today. So we'll be doing a Strengthening Families 101, but let me just put that in the context of these webinars. We do this each month. It's an open invitation to people who are using the Protective Factors Framework, coordinating strengthening families efforts, whether that's for their program or their state or a national organization. We jointly convene these between my organization, the Center for the Study of Social Policy, and the Children's Trust Fund Alliance. Our partners from the CTF Alliance today are off doing a training on protective factors in person. So they are not here to co-facilitate with me today. You're stuck with me, but I do have an update to share from them later. So each month we coordinate a topic, usually with guest speakers, every once in a while, just with someone like me. And we always welcome volunteers to present stuff and suggestions for future topics and presenters. The recordings and materials are all posted by the CTF Alliance. I will put that link in the chat, although it just occurred to me I'm going to be talking most of the time today, so I will grab those links when I can and throw them into the chat. We always post those. They'll be posted by early next week, the recording, any handouts, the slides, etc. So we do this on the second Thursday of each month. You can put that in your calendar, 3 o'clock Eastern, and always just check to see whether the topic is one you're interested in and register if so. Next month, I'm very excited. We'll be sharing the Manifesto 2.0, the parents' version of the Manifesto for Race Equity and Parent Leadership in Early Childhood Systems. You may have seen the manifesto before. It's a short but powerful document. Parent leaders have been working on that through our Parent Leader Network over the last year to revise it and add a lot more examples and context and parent quotes and parent perspective. So we're really excited that's coming out in November, and we will have some of the parent leaders who have led that work presenting on November 14th. So keep an eye on your email for the newsletter with registration details. If you're not already getting those newsletters, you can go to our website, scroll down to the bottom of any page, and there's the Stay Informed button. So you can sign up for the Strengthening Families newsletter and any other newsletters from CSSP that you'd be interested in. All right. So our plan for today to do Strengthening Families 101, we are going to talk about the foundational values of strengthening families, the protective factors with their enhanced definitions that just came out earlier this year, talk a little bit about what implementation looks like, although just the tip of the iceberg on that. And then we'll have some time for questions. I'll share a few updates from CSSP, and I'll share one update from our colleagues at the CTF Alliance. So that's our plan for today. And I'm just going to go ahead and jump in. I do encourage you, use the chat to talk, comment, ask questions. But if you have a specific question that you would like me to answer, please use the Q&A function because I will definitely see that. And while I'm sharing my screen, it's hard to keep an eye on the whole chat. So help me out. Use the Q&A if you have a question you definitely want me to answer. Otherwise, I will try to answer things I see coming up in the chat as well. All right. So, strengthening families. I'm just going to give you an overview of what it's all about. What you see on your screen right now is the logo that we had for strengthening families from, I believe, 2009 to 2024. And we recently updated that. So our new materials have this logo on them. You can find materials on our website, literally hundreds of strengthening families documents on the CSSP website. If they have that old logo on them, that doesn't mean they're out of date, but it does mean they haven't been updated, if that makes sense. The older ones are still quality content, nothing wrong with them, but as we update things, you will see ones that look like this taking over more, and those are the ones you know are the most up to date with the new logo. So when we talk about strengthening families, I think it's always important to start with a reminder that it is both an approach and a framework. So the strengthening families approach is about a set of core values that should inform delivery, service delivery, and program practice that was designed to support families in building their protective factors. So it's a way of approaching the work, and we're going to talk through what those values are all about. And then there's the framework of the protective factors, which is a research-informed set of interrelated attributes of individuals, families, and communities that both reduce the impact of risk factors and promote healthy development and well-being. So I'll talk first about the values and then about the protective factors themselves, and then a little bit about how it looks to actually change your work to build around these things. So as I said, strengthening families is an approach. It is not a model. So it's not an evidence-based model because it would need to be a model first before it can be evidence-based. There are some evidence-based programs that integrate the protective factors or are built around the protective factors and have been evaluated in the way that a curriculum formalized program or model can be. But strengthening families as an approach is broader than that. It is research-based and evidence-informed. So everything in the framework and that I'm going to be talking about today is based on research and based on experience in the field, but the approach itself is not evidence-based. Strengthening families, because it is an approach and not a model, it's not a full package of here's everything you should do and here's what you should say on your third home visit and all of that. It is a package of ways to think about how you approach your work with families. And so we talk about small but significant changes. Nobody's asking you to throw out everything you're doing and say, I do strengthening families now. It's more to look critically at what you're doing and think about what you could change within that to make it more strength-based, more affirming of families' protective factors and helping them to build them, more embodying of the values I'm going to go into soon. But those can all be small but significant changes. You can make huge changes if you want, but implementing strengthening families does not need to mean making huge changes. As I mentioned, it's also grounded in foundational values. I think I've said that a few times now. So we're going to go through those values and what that really means. But some of those values suggest or require changes in practice as well. And then also core to this approach is cross-sector coordination. And that cross-sector coordination is more possible with strengthening families than with a specific model, because you can say, oh, well, in the public health department, these are the ways that we help families build protective factors, and these are the things that we focus on. And then our partners that Help Me Grow and our partners at the Family Resource Center and in home visiting and in childcare, they all use these protective factors in these ways, and we can understand a holistic picture of how we all work together. So that is one of the strengths of it being an approach. It's not just we do this, we do this. It's that we all do work that touches on these same issues and supports families in some similar ways, where we all have our different ways of contributing to that. So all of these point to it being integrated into existing practice. As I said, don't throw out what you're doing and start doing strengthening families, but rather see how you can integrate strengthening families into whatever your existing practice is. All right, so everything I'm talking about today comes from a paper by my colleague, Dr. Charlene Harper Brown. This came out in, I believe, February of 2024. That QR code you can scan, I'll put the link in the chat. I think I will be putting a bunch of links in the chat at the end. Sorry about that if that's inconvenient, but I can't multitask quite that much. So we will share that. You can also just scan that QR code with your phone right now to go to the link. Or you can download the slides when they're posted next week and grab all the links from there. So this paper came out expanding the perspectives and research foundation for the Strengthening Families and Youth Thrive frameworks. We're talking specifically about Strengthening Families today, but Youth Thrive is a parallel framework where Strengthening Families applies to families with kids from 0 to age 8. Youth Thrive picks up where that leaves off and is really about the capacities that children and youth themselves are developing from ages 9 up to 26, which is not to say that 9-year-olds and up, that their parents' protective factors don't matter, But when we think programmatically, working with young people directly and helping to build their own capacities is the approach with Youth Thrive. So this paper came out in 2024, really articulated the values that we're going into now more strongly than they had, or more directly than they had been laid out before, and expands the definitions of the protective factors to be more inclusive of the ways that community, policy, and society can affect families' protective factors. And so we'll get into that in the second half. All right, I keep referring to these values. Here they are. I'm not going to talk through all 7 of them right now because I'm going to talk about each of them individually. So it is 7 core values. They're all very interrelated. The first is to employ a social ecological approach. And by that, we're referring to the social ecological model of human development that was developed by Urie Bronfenbrenner in the 1970s, but which has since become a very widely adopted way to think about human development, and to think about it in ways that are real life and not acting as though individuals exist or develop in a vacuum. So the individual at the smallest circle here, their development is affected by the relationships they have, the people around them, which are also affected by the community around them. And both the individual, the people, and institutions they're in relationship with, the characteristics of their community, are all affected by societal factors. So we need to think about the individual. Usually we mean a child there in this context. We think about a child, then we think about the family they're a part of, the service providers, the care providers, the extended family that they connect with, and then the community in which they exist and live, and how all of that affects their well-being and their healthy development, and then how societal factors also have an impact on protective factors. The next value is to adopt a strengths-based perspective, and that is really to take a perspective about children's, parents, and families' intrinsic value and mobilizing their assets to promote healthy development, address problems, and heal. So when we talk about being strengths-based and trying to increase protective factors, that does not mean we're ignoring risk factors or not paying any attention to risk factors, challenges, and stressors. We are trying where possible to reduce those as well, but our focus and our initial focus is on protective factors. We start from a strength base so that we can better build relationships with people when we're focusing on what's going well for them and how they can use those strengths to overcome whatever challenges they face. It points us to solutions more than just looking at risks does. And we know increasingly that strengths, whether we call them protective factors, positive experiences, assets, they play a huge role in shaping people's trajectory. And so they may play just as large a role as the different risks and challenges. And really, it's the interplay between those two that determines or affects how people's lives will go. And so we need to pay attention to both of them. Many of our systems are really deficit-based. You can't apply for a certain program unless you meet some risk-based criteria. You might not be eligible or invited to join some programs unless you have those risks. When you go to the doctor, especially let's say 30 years ago when you went to the doctor, they were just asking what's wrong with you, right? Now, increasingly, they're saying, how are you doing? How's your well-being? What's going on? But still, our medical model is very focused on deficit and risk. And a lot of our certainly intervening systems that touch the lives of children and families are deficit-based, but even some of our more universal programs for everyone, they still can have a very deficit-based approach in working with families. So we really always need to push this reality-based, strength-based perspective. The next value is to recognize and respond to oppression and privilege. So this is about recognizing how systems of oppression and privilege are rooted in the consciousness of individuals and society, and how these systems unfairly advantage some while disadvantaging others. So In a lot of our communities, those systems of oppression and privilege are probably most visible around things like race and socioeconomic status. But in people's lives, it's also about disability, language spoken, immigration status. There are all kinds of, well, gender and gender identity, sexuality, these all intersect, which goes to our next value. But people can experience both oppression and privilege within these different pieces of identity that they hold. And so that is why we have a value about incorporating an intersectional frame of reference. So really understanding that we need to have an inclusive understanding of the experiences and specific needs of children, youth, parents, and families. So each person's identity and where they sit on those within those different systems of oppression and privilege means that their experience of the world is different. The way the world reacts to them is different based on those identities. And each person's experience may be unique. So we should really ask them about their experience and understand that we can't just say, oh, this is a Black student in elementary school, so I know everything I need to know about what's going on with them. We also need to understand their disability status, their sexuality, their socioeconomic status. All of those things intersect their gender so that they might be having a very different experience than what we thought just by putting them in one category. Closely connected to that is our next value, which is to demonstrate cultural responsiveness, cultural humility, and intellectual humility. So these three terms each have different meanings, but are all very related. So cultural responsiveness is about having respect for cultural differences, providing things in the language that people speak whenever possible, stocking a food pantry with foods that are familiar to the populations you're trying to serve. That is not scheduling things on a holiday that's important to a group that you want to be inclusive of. All of that is about cultural responsiveness. Cultural humility is about self-reflection, about your own attitudes toward different people, and really the idea that there isn't one culture that has everything figured out. We just need to come to people open to learning about what their culture is, and particularly with interest in parenting and families, what are their goals for their children? How do they express their love for their children? All of that can be really influenced by culture. And if we're not coming to people with an open mind, we're not going to see their strengths and we're not going to be able to support them in helpful ways. And then intellectual humility is the next step in that, which is just broadly learning from other people's experiences and perspectives. So never coming into an interaction with a family thinking, I know what's best for them, but rather saying, I'm here to learn about what they need, how they want to solve whatever challenge they're facing, what strengths they have that are going to help them with that. And I have things to add and suggest, but I am open to learning from their experience and perspective so that everyone is on equal footing. Okay. Our next value is amplify constituent voice and power. When we're talking about strengthening families and young children, we generally mean parents' voice and power, although there are places where elementary school age kids should also have voice and power. So they are also constituents in a way, but with strengthening families, we're generally talking about parents. So amplifying parents' voice and power in defining their own goals, influencing their families' lives, and helping to shape early childhood programs, practices, policies, and systems. So we often see a focus on, well, we want parent leadership. We want parents to, show up and testify that our program is necessary for our community. We want parents to influence how decisions are made in our community. Most of that is going to start by supporting and celebrating the ways that parents are leaders and engaging with their own children, recognizing, lifting that up, celebrating that, inviting parents to help shape the programs and services that affect them and their families, so they can both advocate for their own children and their own families' needs, but also start to advocate for, hey, this program needs to work better for families who work second shift, right? Like, how are we doing that? Whether that's my family or not, I see that's a need, and we have to figure out how it works better for them. And then we get up to influencing policies and systems where parents can say, I'm advocating for all the children in my community, or I'm advocating for all the Spanish-speaking families in my community, whatever that might be, but influencing and and thinking about policies and systems more broadly. All of those matter for constituent voice and power, whether it's in that home visit where the parent is the decision maker and we're just asking them about their goals and what they want to do with their children and providing information to support that, right up to the parent that's going to, put together a petition and gather signatures to change something in your community or your state. The final foundational value is pursue equity and justice for all children, youth, and families. We see this as an ethical obligation in the implementation of the Strengthening Families framework. Just trying to be strength-based with the families that meet some certain criteria or families that just happen to walk through the doors or happen to be able to afford a certain program is not our vision of what it means to be engaged in strengthening families. Implementation of this framework should really mean thinking about all the children and families in a community and thinking about how we can pursue better and more just outcomes for all of them. So that is our 7th value. I'm going to put this up on the screen for a minute. See if anyone wants to come off mute or just type in the chat. Which of these values resonate the most with you? Do any of them feel like a significant shift? While you think about that, I'm going to grab some of the links that I've been meaning to put in the chat. So I will do that and wait to see what you all say. While we wait to hear if anyone's going to chime in, which I believe you might need to raise your hand in order to come off mute, but feel free to do that. I will also share that at the Together for Families conference in a couple of weeks, actually, I think it might be 2 weeks from today, my colleague Cailin Harper Brown and I will be presenting a session specifically about these values and really digging in on all 7 of them. So I hope many of you will join us for that. I see a question from Ileana. What about the anti-racism framework? We do have a framework, social ecological model for racism and anti-racism. Those ideas are woven throughout the paper that Cailin wrote with these values. And I can share the link to that as well. Let me find it while we see if any other questions are coming in. We did develop that framework prior to, we had developed that framework and then Cailin was writing this paper. And so it's very much woven in. But I did just put the link in the chat for anyone who's not familiar with that. I see a couple comments here. So from Benjamin, I appreciate the reminder that regardless of the families we currently serve, we should be striving for equity and justice for all. Thank you. Yeah, I'm really glad that we are making that really clear in these new materials. Jill says, I love strength-based perspective and working with families. Excellent. Malcolm says, we've been emphasizing constituent voice and power in a project we're using to support partner agencies in implementing the 5 protective factors. Amazing. Love that, Malcolm. We should probably talk soon. I'd love to hear more about that. Okay, I'm going to keep us moving. I did get some of those links in the chat, so I don't feel quite as delinquent now. We'll get more chats in later as we go. All right. Next, we're going to get into the protective factors themselves. So I always love this quote from Dr. Carl Bell, who was a psychiatrist at the University of Illinois. And he just summed it all up in one statement saying, risk factors are not predictive factors because of protective factors. As I said earlier, when talking about the strength-based perspective, there are a lot of reasons to focus on protective factors that are about, just the relationship that creates with families and our ability to actually help them make changes in their lives that will be positive. But really, when we get down to it, we know that there are certain risk factors that kind of point to poor outcomes, but we know they're not entirely predictive. And what intervenes in there are protective factors, positive experiences, relationships, interactions that are positive. All of that matters. And so we know the path from risk factor to a poor outcome is not preordained. It's not necessarily going to happen. And protective factors are how we can make sure that folks get a better shot than what their risk factors might predict. So the 5 protective factors are listed here on screen. I'm going to talk through each of them, but I just like this pretty slide, so I included it. And I will go through them one by one. So on each of these slides, what you see is the definition of the protective factor, and then a poster that was developed by a group of parents in Alaska. This is many years ago, so you will see this has the older logo on it, and it has some language that is from the way we talked about the framework before, but still the concepts have not changed. We've just broadened them, so no concerns there. But I just think it's great to see how a group of parents from villages in Alaska, many of them Native Alaskan, came together and came up with words and images for each of these protective factors in their own, what resonated with them culturally. And so I think we actually have examples from other states or communities that have done this. It's a powerful exercise to have parents work together on how they would want to express these things for it to make sense to other parents in their communities. And the Alaska ones are just beautiful, so I'm sharing them here. So our first protective factor is parental resilience. And by this, we mean managing stress and functioning well, facilitated by individual, relational, community, or societal factors when faced with stressors, adversity, or trauma. So here you see that social ecological model popping up again because one of the big shifts here was with the new definition was really to make it explicit that resilience, an individual's resilience, is influenced by all of these factors. It's not, first of all, it's not something that you either have or don't have. Second of all, it's something that can be built over time and throughout life experiences. But most importantly, it's not just on the individual to either be resilient or not be resilient. There are all kinds of factors that play into that. And there is a lot of connotations with resilience now and cultural dialogue about resilience that actually led us to have some big conversations at CSSP about whether we should continue to use that term. But as a psychological term, it is accurate. It is the best way to state what we mean here, which is really that people can find ways to overcome stressors, adversity, or trauma, and they can both overcome those things and learn and grow from those things and become stronger for the next challenge they might face. And that all remains true, even though we also think maybe there shouldn't be so many stressors, adversity, and so much trauma in people's lives, and we need to work to try to remove those things. But we also want to acknowledge the human ability to grow and learn and continue to manage stress and function well. So the other thing I'll point out with parental resilience is that we have the word parental here. Resilience is a concept that applies to everyone. For parents, there's a special need for resilience, that it's a lot harder to not get out of bed one day if you've got little kids that you're responsible for. It's also just parenting is demanding. There's a lot of stress on parents. We saw that Surgeon General's report last month about the stress parents are under, but parenting, even in the best of circumstances, is a stressful thing. Young children need constant attention and don't have a lot of patience for adult needs. And so the type of resilience that parents need is about being able to show up as the parent they want to be, even when other things are going wrong, to have that extra patience that young children can require, even on a day that's already been stressful for other reasons. So parental resilience in particular is what we call out here, both because parents need resilience like anyone else does, but also because the job of parenting requires a certain amount of a special resilience. I'll just stop for a second because I saw a question in the Q&A about whether this will be available. Yes, the slides and the recording will be available. They'll be posted by early next week on the website of the Children's Trust Fund Alliance. Okay, next up is social connections. And for this, the Alaskan parent group I can't remember the name of this game, but they chose a photo of a community coming together to play this game, where someone gets tossed up in the air and everyone's there together. And that's how they were illustrating social connections. So by social connections, we mean healthy, meaningful, trusting, and sustained relationships with people, institutions, communities, or a higher power that promote a sense of connectedness, belonging, and mattering. This definition has the most commas because it has the three different sets of items that we are referring to here. Healthy, meaningful, trusting, and sustained relationships. So what we mean here is not that every single relationship needs to be lifelong, but that you're not just, chatting with the cashier at the grocery store as your only social connection, right? So healthy, meaning there's give and take. There are all kinds of definitions to healthy relationships. Meaningful to the person, trusting, and sustained, at least for some of those relationships. People need these types of relationships, and they can have them with other people. That's our most obvious association with it. It might be extended family, might be your partner, might be your neighbors, your coworkers, the other parents on the soccer team, or whatever that might be. But everyone needs people in their lives. We also have social connections with institutions. So many people are a member of a faith-based community, and the fact that they're a member of that institution is a form of relationship that they know there's somewhere they would turn if they did need some help. That could be a family resource center that they're a part of. They don't know every single person there, but they know if they walk in those doors, they can get some support. And then we have communities there. So that could be a community like your literal physical community, like, oh yeah, we have traditions in this community. We have things we do. I'm responsible for bringing my signature dish to the potluck, whatever that might be. But also community in the sense of, the other parents on the soccer team. We have a community on the sidelines, and we all know each other, and we have a group chat, and we pay attention to who's doing okay, who might need some support, who needs their kid to get picked up because there's something else going on with their family right now, whatever that might be. But people belong to communities that are based on shared interests or shared places they have to be every Saturday morning, or their identity groups, their language, their gender, sexuality. Immigrant groups certainly have strong sense of community within, that might not be geographically defined. And even in our increasingly online world, people can be part of a community that's like the fandom for a show they love, and they connect with those people online, even if they don't know them in real life. All of those types of communities can be where people find their social connections. And finally, we list a higher power here, which helps to give people that sense of connectedness, belonging, and mattering. Of course, that might be connected to what I said, like if you're a member of a faith-based community and you could show up at church and get the help you need. But also just the belief in a higher power, which might be a religious belief, a spiritual belief, or a connection to nature, something like that, that gives a person a sense of belonging and mattering. So lots can be bundled up in those social connections, but that's how we have it all summed up in one definition at this point. All right, our next one is knowledge of parenting and child development. The poster from Alaska, the parents put a little water buffalo family on there. We define this as learning about prenatal, infant, and child development, and using developmentally and contextually appropriate parenting practices. One important thing to note here is that we do not use the phrase best practices because that is really hard to apply across different contexts. So we have developmentally and contextually appropriate parenting practices. And even developmentally appropriate will vary based on a child. So it's not that every 24-month-old needs exactly all the same parenting strategies, right? We all know there's a wide variation in that, even among typically developing children, but certainly when you add in children with a developmental delay, all kinds of different things that can be affecting what a child needs that's developmentally appropriate. We also, the really critical piece here is not just learning about this child development, because people can read all kinds of books, but using appropriate parenting practices for their context and for their child's development. And often the supports that we provide in the family support field, like parenting education classes or home visiting, or the kind of education we give parents in the context of early care and education, that is about applying knowledge more than it is about, I want you to memorize, different psychological thoughts about development, but much more, what are parenting practices that you might try out and use with your family? All right, then we have social and emotional competence of children. Great picture here of some kids having fun with a dog in Alaska. And the definition is providing environments and experiences grounded in early relational health that build positive social skills, enable children to regulate thoughts, emotions, and behaviors, and promote effective communication, problem solving, and decision-making skills. Again, a few different clauses within this, but it really is about what parents are doing to provide those environments and experiences to help children build these skills and capacities. And we know that this, again, is very much dependent on developmental phase, context, what the families are going to do to promote their children's social and emotional competence can vary a lot, but the fact that parents are paying attention to this and knowing how to promote it is going to be very important, both for the child's well-being and for the family's well-being and, day-to-day stress levels and all of that. The final protective factor is concrete support. We actually changed the name of this one. It was called Concrete Supports in Times of Need. And we kind of, with a lot of conversation with partners, thought, often this is just shortened to concrete support anyway, but really we're talking about concrete support that doesn't have to be in a particular time of need, but any time that a family has young children, there are needs, and the concrete supports they get to meet those needs are important. So this is defined as identifying, accessing, advocating for, and receiving high quality and equitable support, including the basic necessities everyone deserves and specialized services to address specific needs. So those basic services and meeting basic needs should be accessible to everyone, but we also know that as special needs are identified or a family's in a particular moment of time where they need a lot more support, that they can also identify and access those supports then. Concrete support includes formal things like the child tax credit and food pantries in the community, but it can also mean informal things that come through social connections. So it can mean just that there's somebody there who can give your kid a ride when you have to take your other child to a dentist appointment, or whatever that kind of concrete support might be. Somebody bringing over a casserole when you have a new baby home from the hospital. Those types of things are also concrete support, but they tend to come through informal social networks. Whereas our society and our communities need to be set up in ways that people can access those supports if they don't, for needs that aren't being met through their social connections. Finally, we do have a section in the paper about culture as an overarching protective factor. So we didn't add it to the list of 5, but we do think culture needs to be taken into account because it has such an influence on all of the other protective factors, as you can read on the slide here. So I won't read through those, but just want to make sure that you understand we have those 5 specific protective factors, but we believe those protective factors are universal. They apply across cultures, but the way they show up in families, the way that families express them, can be really different based on both their big picture culture, the where their ancestors are from, that level of culture, but also just the culture of the community they live in, the culture of the family they've built. All of those things can influence the other protective factors in the ways listed here. Okay, next question. Which protective factor or factors do you focus on most in your work? And which protective factor do you think families need the most support with right now? You can put that in the chat, or raise your hand if you'd like to come off mute. Okay, I see Brianna has a hand raised. Let me find you. Oh, did you put it back down? Hold on. Let me find you. Why is this so hard? Here we go. Okay, you should be able to unmute yourself and speak now.
So I have found that the one that I use the most within our work is parental resilience. We have found that so many families, or that families that I have come in contact with or do um, a lot of, coaching, mentoring, that kind of thing with, right? They're just kind of at this point of really feeling that they're on an island by themselves, and what can they do to continue to know that they are strong, and that they have the ability to do the things that they need to do, not only for themselves, but for their children, for their household. And I think it's just all about empowerment, right? That I feel that sometimes they're like, okay, well, you have all the answers, so like you can just do it for me. And that's not what we want for them at all. Because then they don't learn how to become their own advocates. So that's one um protective factor that I feel that I use a lot. um and then I think the most that families need support in, I think, are those social connections, but also concrete supports. I think social connections, right? Like, who is it in their village, right, that they've identified to be those people of support, but also having that conversation of what that needs to look like individually for each person. And then concrete support, I think, too. Same thing with social connections, is that they may often feel like, one, they don't know, right, what's out there. So building that awareness, but also feeling ashamed, right? So how do we lessen the stigma? How do we break down those barriers that it's okay to ask for help? But then again, when we look back at those cultural factors, right, that sometimes what happens in our home stays in our home, and that's just built on generational and cultural factors. But it doesn't mean that we stop trying, right? It doesn't mean that we don't continue to give them the resource, we don't empower them, we continue to have them be their own advocates, and really just feel confident and comfortable speaking about the things that they need.
Great, thank you so much for sharing. You touched on a lot there. And I just agree so much. I think social connections right now, especially after the pandemic, and for people who became parents during the pandemic, that is a challenge to kind of figure out how to do this parenting thing in community and with other people when you started out having to do it pretty siloed in your own home. So I think that's an area we're all still recalibrating to. Thank you for sharing. Okay, and thanks to everyone who's been putting things in the chat. I hope you're all reading those and chiming in where you want to. Lots of protective factors mentioned here. And I think most people are naming multiple ones, which is often how it works. They're also connected to. Okay, I'm going to keep moving to talk a little bit about what it looks like in programs to help families build protective factors, and then what it looks like in communities. So I'll only be able to touch on these things in the time we have today, but I do hope you will look up other resources and, learn more about this as you go. Okay, so first is about how programs help families build protective factors. A lot of what happens in programs is building an environment where families feel supported. So building, whether that's a childcare program where parents know that they're welcome to hang around sometimes, and there's, things for parents there, not just for children, or the environment you set, with a home visit where you walk in and create a certain environment, even though you're in their home, you're creating a welcoming thing, and that happens through relationship, of course. So within that environment, you build relationships, those relationships that are positive, affirming, recognizing parents as individuals who have names, for example, can be a big leap for some programs. But that really goes a long way in building a relationship. Establishing whatever type of service provider you may be, establishing that you and your staff are there for parents that might have questions. Even if I don't have a question right now, if I know it's very clear that you are a source for that support, that can be helpful. And just open that door for me to come and ask you a question when I have one, or tell you when something's a little stressful in my life. And the way that we see providers actually helping families build protective factors is with what we call everyday actions. And you can see those listed here. This is a handout or a graphic actually created by the Children's Trust Fund Alliance that just shows all of these everyday actions. These actions intersect. So you might say, well, I'm going to do one of these everyday actions. It's actually going to build 3 of these protective factors. Yes, it's not a one-to-one, but we tried to cluster them in ways that kind of make sense for people to think about their own work. And if you use the Strengthening Families self-assessment for your program, it is built around these everyday actions with much more detail about what your program might be doing to carry out these everyday actions. But these everyday actions are also things that you can do when you're walking down the street and, see a family on the way to the playground. They are things you can do with your neighbors and your extended family. They don't necessarily happen in a professional context. Of course, I'm not going to read through all of these right now. You can get the handout, or sorry, the slides will be posted where you can look at this more closely. And we have a lot of materials on our website about these everyday actions as well. Sorry, there's some weird graphic overlay here, but this says opportunities for everyday actions. We have some materials, mostly still in development, but we do have some available about how you can take a protective factors approach in all of these different ways you might interact with families. So this is, rather than looking at it protective factor by protective factor, it's looking at it in terms of what's this interaction you're having with a family, and in what way can you take a protective factors approach here. So we have that broken down into how you engage families, how you assess children and families, whether that's formal or informal assessment, how you deliver services, how you address challenging behaviors or parenting concerns, how you organize family events, if that's something your program does, how you refer families to other services and supports, and then how you take care of yourself and other staff with a protective factors approach. We also have, this is sort of a general wheel, I guess it's a wheel of these areas of engagement with families. We also have one that's built around a child welfare practice model, a sort of generic practice wheel of the different steps in the life of a child welfare case and how a protective factors approach can be relevant there. So if you do work in child welfare, I encourage you to check out those tools on our website. Strengthening Families and Child Welfare as a search term, this will come up. Okay, so that's what programs can do. What does it look like when a community supports parents to build their protective factors? There we are. Here you're looking at what we call a daisy that shows all these different systems that might interact with families, or that do interact with families. Not all families interact with all of these systems, but all of these systems interact with some families with young children in the community. And if they are all speaking a language of families and protective factors in the center of it, then they are more likely to be able to make positive, strong referrals, including like warm handoffs, where they're not just giving somebody a flyer about your program, but they're calling you and saying, hey, I'm sending so-and-so over. They're going to come to your playgroup next Thursday. And here's what's, why I'm sending them to you. When you're having those conversations about who does what, who focuses on which protective factor. So you might be a program that is really good on 2 of those protective factors, but you really don't have the capacity to be doing some of the other things. But if you know who in your community is, then you can still make sure families are getting those needs met. So we also know that this daisy of services exists within community, because no parent is going to say, I'm raising my kids within this preschool, this home visiting program, this park, it's what community you live in. And so there are other factors that come in here. There are the policies, the history of that community, the culture within that community, the cultures within that community and how those cultural groups interact with each other, the social norms of that community. All of those things matter for how these programs operate and how families are doing and what types of support they have. So we have this vision of an embedded family support system throughout a community. So that looks like light touch family support in the settings that families are in every day. So when you go to library story time, it's not just about the book. It's about helping people build social connections, and it's about that librarian knowing there might be referrals she needs to make if somebody comes in and is clearly stressed out with their child or whatever that might be. Then there are connections and support from dedicated family support resources in the community. So there is something like a family resource center that folks can go to and that the librarian can refer people to, and the grocery store has a flyer up about it, and people know how to find that. Then we have connections to more intensive services when needed. So when there is a developmental concern or a job loss or whatever it might be, if family needs some extra support, they can get connections to those more intensive services through the dedicated family support resources. And then we also love to see navigation supports to help make those connections, and for families that are juggling involvement with multiple systems, how can we help them smooth that out and make it go better? And what we want to see is common language and commitment to helping families build protective factors across all of that, and also policies and community conditions that strengthen families. So all of those things can happen better in a community where there are policies in place that support families more broadly. So the last sort of graphic I'm going to share here is community conditions that strengthen families. And this is from work that CSSP did with Safe and Sound. Malcolm is on the call today. He's been putting some things in the chat. And other partners that wanted to really think about what it is in a community that makes families more likely to thrive, that prevents child abuse and neglect. And so we did a survey of the field. This information fed into the paper that came out earlier this year, but there's also a paper just about this, which I'm happy to share if anyone wants it. But it's also on our website, cssp.org. But what you see here are within this pyramid, the top, we have those essential and basic needs that families need to be able to access and use for their family. We have social support and connection, which is closely related to the social connections we've already talked about. Then we have the social contract, which really refers to a shared understanding that raising children is everyone's business, and we need to support families, that parenting is hard, but everyone has an interest in kids thriving. So that social contract, that it's okay to ask for help and that people have each other's back. And then at the heart of it all, in the center of the pyramid, we have racial and social justice, because we know that in every community in America, access to these other pieces, these other community conditions, is not standard across the whole community. It might vary by socioeconomic group and, wrong side of the tracks kind of thing. But it also is often determined by racial and ethnic groups, immigrant status, language spoken. Those things can mean that different people have very different access to all of these other community conditions. So a focus on racial and social justice is critical to achieve positive changes. Okay, so that's our story about strengthening families. We just have a few minutes left. So I'm actually going to encourage you to put questions in the chat or the Q&A, but I am going to continue moving through the slides because I have a couple updates to share, and I don't want to run out of time for those. So while you're typing, I will put these questions in the chat. You really don't need to see me again. Okay, so just a reminder again about the Together for Families conference that is coming up in a couple weeks. We have 4 plenary sessions and over 50 engaging interactive breakout sessions. I just saw right before we started here that the full the full schedule is available on the Together for Families website now. So if you're already registered, it's time to go look at which sessions you want to attend. And if you aren't registered yet, go check that out and see if something piques your curiosity and is worth registering for the conference for. We would love to see you there. Also wanted to share that CSSP is one of 7 partners in the Early Learning Nation Collective that recently launched. So you can check out our website at elncollective.org. And I also wanted to share a few opportunities we have coming up quickly or soon from CSSP for the ELN Collective, and I just put these links in the chat as well. We have some early learning community cohorts. One will start in November. We're still looking for people for that. So if your community might be interested in working on how you can all come together to better support early learning, please check that out. We also have parent leadership and advocacy cohorts. We'll have an English one and a Spanish one, both starting in 2025, and we would love to get parents signed up for that who could benefit. And lots more opportunities to come from the partners in the collective. Related to that, the Early Learning Community Action Guide and Assessment Tool is one of the foundational pieces for the Early Learning Nation Collective. That is a publication of CSSP. You will see references in it to strengthening families, protective factors, and a lot of language that will resonate with a lot of things I've said today, which tends to happen when I write things. So, sorry, my phone is also ringing. Also wanted to share an update from the Children's Trust Fund Alliance. Maureen couldn't be with us today because she's actually doing a training of trainers today, but they have another training coming up December 2nd through 5th. That'll be an online, open to anyone training. And they often do these trainings for a particular state or a particular group. And so when they have these open to the public ones, it's a great opportunity to get that certification and be able to offer protective factors training in your community or state. All right. Those are all the updates that I needed to share. So now I'm going to check and see if anyone put questions in the chat. I don't see any yet. Did anyone actually have questions you want to have answered? If not, we can call it a day. Okay, it's looking quiet out there, so thank you for joining us. Let's see, I see you're looking for protective factors. Oh, for the training? Good question. Let me see. I think what you should do is contact Maureen Holliker. So I'm going to type her email in the chat here. So she can get you more information about it. Otherwise, if you just go to ctfalliance.org, you will find their training information. I think you just have to scroll down a little bit. Thank you for the thank yous in the chat. Great to have you all join us. It's fun to do this overview of the whole thing, and I'm glad to see some of you saying to see you at the conference. That's great, very exciting. Looking forward to seeing you there. Thanks, everybody.